Hi everyone, welcome back to our channel. Please like, share and subscribe our channel for more video and more update. Today we will discuss about the NORCET PYQ set 1. Let's start. The normal range of intracranial pressure in ICP in adults is option A 0 to 5 mm of Hg, option B 5 to 15 mm of Hg, option C 15 to 25 mm of Hg, option D 25 to 35 mm of Hg. The answer is option B 5 to 15 mm of Hg. The ICP is normally maintained between the 5 to 15 mm of Hg. When it will increase, this level indicate the increases ICP and the risk of brain damage. The risk of brain damage. When it will increase the risk of brain damage. Next. A nurse is caring for a patient with hypoparathyroidism. Which electrolyte imbalance should the nurse expect? Here they told hypoparathyroidism. Option A hypercalcemia, option B hypocalcemia, option C hyperkalemia, option D hypokalemia. The answer is option B hypoparathyroidism. So the answer will be option B hypocalcemia, because hypothyroidism reduces the parathyroid hormone secretion and decreasing the calcium absorption and causing the hypocalcemia. So answer will be option B hypocalcemia. Next, which fetal heart rate pattern is most concerning during labor? Option A early decelerations, option B variable decelerations, option C late decelerations, option D accelerations. The answer will be option C late decelerations, because late decelerations indicate uteroplacental insufficiency and fetal hypoxia, lack of oxygen in the tissue, fetal hypoxia and requiring urgent intervention. So late deceleration is the most concerning during labor. The answer is option C. Next, which drug is the antidote for the organophosphate poisoning? Option A naloxone, option B atropine, option C flutamine, option D protamine sulfate. The answer is option B atropine. Atropine blocks the excessive acetylcholine. What they did, atropine blocks the excessive acetylcholine effects caused by the organophosphorus. What happened? Organophosphorus poisoning when occur, then when they will give the atropine, then they will block the organophosphorus poisoning. So the antidote is atropine. Option B is the correct answer. Next, in CPR, the recommended chest compression depth for an adult is option A 1 to 1.5 inches, option B 2 to 2.5 inches, option C 3 to 3.35 inches, option D 4 inches. The answer is option B 2 to 2.4 inches. According to AHA, American Heart Association guidelines, adult chest compression should be 2 to 2.4 inches. If they are asking in centimeter, 5 to 6 centimeter depth. Next, the drug used to prevent respiratory distress syndrome in premature infants is option A dexamethasone, option B surfactant, option C magnesium sulfate, option D hydrolyzine. The answer is option B, surfactant. Surfactant, because surfactant therapy reduces the alveolar surface. This is alveolar. It is reduce the alveolar surface tension and preventing the collapse. If like that, they will prevent the collapse. This is the alveolar. Next, so answer is option B. Next, which isolation precaution is required for a patient with pulmonary tuberculosis? Option A, contact precaution. Option B, droplet precaution. Option C, airborne precaution. Option D, standard precaution. The answer is option C, airborne precaution. Option C is the correct answer. Pulmonary TB requires airborne precaution and also needs the N95 respiratory and negative pressure room, N95 mask and negative pressure room. Next, the most reliable sign of pregnancy is option A, amenorrhea. Option B, nausea and vomiting. Option C, positive ultrasound detection of fetal heartbeat. Option D, breast tenderness. The answer is option C, positive ultrasound detection of fetal heartbeat. Option C is the correct answer. Next, which is the earliest sign of magnesium toxicity? Option A, loss of tendon reflexes. Option B, respiratory depression. Option C, cardiac arrest. Option D, hypotension. The answer is option A, loss of deep tendon reflex, because deep tendon reflexes are lost fast, followed by the respiratory depression and cardiac arrest at higher toxicity level. So answer is option A. Next, the antidote for benzodiazepine overdose is option A, naloxone. Option B, flumazenil. Option C, protamine sulfate. Option D, atropine. The answer is option B, flutamine. Option B is the correct answer. Next, which hormone is secreted by the posterior pituitary gland? Option A, growth hormone. Option B, thyroid stimulating hormone. Option C, antidiuretic hormone. Option D, adrenocorticotropic hormone. The answer is option C, antidiuretic hormone. The posterior pituitary release the ADH, also known as the vasopressin, and oxytocin. These two hormone releases by the posterior part of the pituitary gland, and anterior part of the pituitary gland, they are releasing the GH, growth hormone, TSH, thyroid stimulating hormone, ACTH, adrenocorticotropic hormone, etc. like that. Next, which nerve is damaged in the Bell's palsy? Option A, facial nerve. Option B, trigeminal nerve. Option C, glossopharyngeal nerve. Option D, vagus nerve. The answer is option A, facial nerve. Facial or nerve damage is in the Bell's palsy. Bell's palsy is caused by the inflammation or the compression of facial nerve. Facial nerves is also known as the seventh cranial nerves. Next, the drug used to reverse the effects of heparin is option A, vitamin K. Option B, protamine sulfate. Option C, warfarin. Option D, phentonadione. The answer is option B, protamine sulfate. Protamine sulfate used to reverse the effects of the heparin. Next, the normal range of CVP is option A, 0 to 4. Option B, 4 to 10. Option C, 12 to 18. Option D, 18 to 24. CmH2O. The answer is option B, 4 to 10 CmH2O. H2O. Normal range between the 4 to 10. Elevated, it increase the fluid overload or the right-sided heart failure. Next, in which position should be the patient placed during the lumbar puncture? Option A, supine with the head elevated. Option B, prone with the head turned. Option C, lateral recumbent with knee flexed. Option D, sitting upright with the leg extended. The answer is option C, lateral recumbent with the knee flexed position. Next, which of the following vaccines is contraindicated in pregnancy? In the pregnancy, live vaccine are contraindicated. Option A is tetanus toxoid. Option B, hepatitis B. MMR is a live vaccine, so answer will be option C. MMR is contraindicated. Next, which electrolyte imbalance occurs in Addison disease? Option A, hypernatremia and the hypokalemia. Option B, hyponatremia and hyperkalemia. Option C, hypercalcemia and hyperkalemia. Option D, hyponatremia and hypocalcemia. The answer is option B, hyponatremia and hyperkalemia, because in Addison disease causes the reduced aldosterone, leading to sodium loss and potassium retention. So answer will be option B, hyponatremia and hyperkalemia. Next, which is the most common site for intramuscular injection in infants? Option A, deltoid muscles. Option B, ventrogluteal muscle. Option C, vastus lateralis muscles. Option D, rectus femoris muscle. The answer is option C, vastus lateralis muscle. Option C is the correct answer, because vastus lateralis is the safest muscle for the IM injection sites of the infants due to well developed muscle and low risks of the nerve damage. Next, which ECG change is seen in hyperkalemia? Option A, tall peaked T wave. Option B, flattened T wave. Option C, ST segment depression. Option D, prolonged QT interval. The answer is option A, tall peaked T wave, because hyperkalemia causes tall peak T waves and widened QRX complex and possibly cardiac arrest if severe. Next, which part of the brain regulates balance and the coordination? Option A, cerebrum. Option B, cerebellum. Option C, medulla oblongata. Option D, hypothalamus. The answer is option B. Option B is the correct answer. Cerebellum is regulated balance and the coordination. Next, which of the following is the cardinal sign of Parkinson's disease? Option A, muscle hypertrophy. Option B, tremor at rest. Option C, hyperreflexia. Option D, ataxia. The answer is option B. Option B is the correct answer. Tremor at rest, because the classical triad includes the tremor at rest, rigidity, and bradykinesia. So answer will be option B. Next, a patient with COPD is at risk of respiratory failure in which excessive oxygen, because option A, oxygen causes lungs collapse. Option B, hypoxic drive is suppressed. Option C, oxygen increases carbon dioxide diffusion. Option D, oxygen causes bronchoconstriction. The answer is option B, hypoxic drive is suppressed. Next, which antenatal findings is suggestive of the abruptio placenta? Option A, painless vaginal bleeding. Option B, painful vaginal bleeding. Option C, premature rupture of membrane. Option D, soft relaxed uterus. The answer will be option B, painful vaginal bleeding. Next, which instrument is used to measure the intraocular pressure? Option A, ophthalmoscope. Option B, otoscope. Option C, tonometer. Option D, laryngoscope. The answer will be option C, tonometer. Tonometer is used to measure the intraocular pressure. Next, which condition is characterized by the polyuria, polydipsia and the polyphagia? Option A, diabetes insipidus. Option B, diabetes mellitus. Option B, C, the SIADH. Option D, hypothyroidism. The answer is option B, diabetes mellitus. Option B is the correct answer, diabetes mellitus. Thank you everyone. Please like, share and subscribe our channel.